Good morning. My name is Kira. I'll be performing your imaging today. Before we begin, can I just grab your full name and your date of birth?
Mike Mills, 8th of the 7th, 54.
Thank you. Do you know what you're coming for today, Mike?
Yep, I'm here for my iodine ablation treatment for my thyroid cancer.
Great. So as you've just mentioned, we'll be administering an ablative dose of a radioactive element called iodine 131 in a little capsule form today. The procedure is designed to break down or ablate any residual healthy thyroid cells remaining after the thyroidectomy you had a little while ago. This is just going to help us visualize and detect any thyroid cancer cells or any metastatic lesions in the future. You may have to have this procedure a few times before all the healthy thyroid tissues are gone. However, we won't know that until we do our post-therapy scan in a few days from now. Any questions so far, Mike?
No, that sounds good.
Okay, before we begin, I just need to confirm a few things with you. Have you been following the low iodine diet recommended to you?
Yes,
Perfect. And approximately how long have you been following this diet plan for?
just over 2 weeks.
So secondly, have you received the 2 scheduled thyrogen injections over the past 2 days?
Yes.
Okay, that sounds good. I'm just going to go over some potential side effects and some symptoms you might experience before we administer the dose today. Did you have any questions before we do that?
No, I'm all good at the moment, thanks.
Great. So today's procedure does carry some short-term side effects, which include swelling or some tenderness of your neck or salivary glands. You may also experience some nausea or vomiting, some dry mouth or eyes, or you may notice some changes in your ability to taste. Just want to reassure you that if you experience any of these are completely normal, okay? Any questions?
Can I do anything to prevent any of these symptoms?
So we do recommend if you chew some gum or suck on some hard candies, that can help reduce any of the dry mouth symptoms. And there's some specific medications that we can prescribe for nausea, such as a danzatron.
Okay, thank you.
So the procedure does carry some potential longer side effects, including hypothyroidism, and some secondary tumors such as leukemia, bladder, breast, or salivary carcinoma. Additionally, there is a smaller risk for a decreased fertility in males, and we do recommend waiting 3 months post your last iodine 131 treatment before you father any children. Any questions?
No, that sounds okay.
Okay, so once we administer the iodine dose today, there's a few precautions that you'll need to undertake in the next few days to weeks. I'm going to quickly run over some of these with you and provide you with a pamphlet before you head off today, and it's going to cover all the information we've covered today.
Okay,
Oops, sorry. So
sorry.
you need to maintain distance between yourself and others. It's especially important within the first 48 hours. We recommend maintaining a 3-meter gap between yourself and others for the first 24 hours. For the remainder of the week, we recommend maintaining about 2 meters between you and others. Additionally, any public transport should be avoided for the first week following your treatment, and avoid driving with others for anything over 1 hour a day. Sharing a bed and engaging in any intimacies also should be avoided. Any questions so far?
No.
So don't share any objects or cutlery, bed and linen, clothing, food or drinks with others, and any objects that you do share with others should be wiped thoroughly. Items containing any bodily fluids should be disposed of in a separate area. And when urinating, we recommend you sit down to avoid any splashing and flushing the toilets 2 to 3 times to avoid any background radiation exposure. Did you have any questions about anything we've discussed?
No, that sounds good.
Okay, great. So today as I said, we'll be giving you a capsule, and then we're going to get you to stay in a private hospital room for the first 48 hours or so, or until the recorded radiation level is below an accepted threshold. Then we'll get you back in 7 to 10 days, where we're just going to do a whole body post-therapy scan. This scan in a few days takes about 40 minutes all up. We're just going to take some pictures head to toe, and we'll take some additional images of your chest and your thyroid area, and potentially a 3-dimensional picture as well. If you're happy to go ahead today, I'll just get you to sign this form stating the procedure has been explained to you, just confirming that there's no risk of pregnancy or current breastfeeding for yourself, and that you consent to proceed.
Yep, I consent to proceed.
Perfect. So I'm just going to give you the capsule now. I'm just going to pop it in a cup for you. Make sure you don't touch it and don't chew it. Just swallow it with the water that we provide, okay?
Okay.
Perfect.